We continue with Mr. Don Charles, who is at present a PhD economics student doing energy economics and econometrics. Mr. Charles has done his MSc work in health economics and is presenting to us today a global value chain analysis of offshore medical universities in the Caribbean. Let's welcome him.
All protocols observed. My study is a global value chain analysis or cluster review, cluster analysis of the offshore medical universities in the Caribbean. A brief background: in the Caribbean, medical universities can either be categorized as either regional or offshore. The regional medical universities are institutions that predominantly train in students to practice medicine in a Caribbean region. The offshore medical universities typically refer to institutions training students seeking to practice medicine in the North America, one of the North American, that's US, United States, or Canada, so forth. The majority of these students seeking to pursue studies in the offshore Caribbean medical universities are those students who typically have low scores at the Medical College Admissions Test, MCAT test. Now, the objectives of this study are to, 1, present an overview of the offshore medical university cluster in the Caribbean, 2, evaluate the challenges experienced in the cluster, and 3, explore the strategies to address the challenges in the cluster. Now, the offshore medical university cluster in the Caribbean developed since the 1970s. There was entrepreneurs who saw a demand for tertiary medical education in the United States that was not being met domestically. So what it did is that they sought to meet this demand with supply. There are a number of factors that actually targeted, that actually favored the targeting of the Caribbean region. One was the region was relatively close, geographic proximity to the North American region. 2, the desired language of instruction was in English. 3, the requirements for establishing a medical university in the Caribbean are significantly lower in the Caribbean than in the US. As a matter of fact, only a business license is required to actually set up a medical university, whereas in the United States, there are a lot of requirements, so forth, in terms of research and so forth. Now, this table more or less presents an outline of the different countries that have a number of medical universities that have in each Caribbean country. So in total, there were 72 medical universities in the Caribbean as of July 2015. Now, I'm not going to detail in terms of the table. You all could see the table. We'll get the slide afterwards. Now, this figure presents more or less an outline of the steps required to acquire a medical degree and practice medicine in the United States. So the first step is that students must be enrolled in university and we pursue courses in taught sciences. So you spend 3 to 4 years in such a program, and then you're required to write United States license exam, USMLE, step 1. Successful completion of the exam, students will proceed to 2 years of clinical rotation. When they pass the after completing the clinical rotation, they proceed to USMLE step 2 exam, and then acquire a medical degree. After that step, they proceed on 1 year of medical residency at a US hospital, and success upon that, they pursue USMLE step 3 exam. Only after passing such exam, then they'll be eligible to actually practice medicine in the United States. Now, the offshore medical university cluster provides some benefits to Caribbean countries. Now, I'm not going to all detail all the benefits, but I'll just highlight the more major benefits. Some of the benefits include the taxes that are paid by universities to the relevant host countries, the government, the income tax paid by faculty staff and faculty staff and academic staff, tariffs on imported products. Obviously, some products will be imported, so it will incur some kind of tariff revenues, and expenditure of students and faculty staff on accommodation, living expenses, and so forth. There are other non-financial benefits that accrue to the host country. Some of the non-financial benefits include the increased medical access for some of the students, that some of the citizens who reside in host countries, someone actually pursue a medical degree in the host country. Now, I want to make this point at this point that this is relatively small, a small percentage of student population, relatively 2 to 3% in each host country, because these offshore medical universities typically target the North American students. There's an increase in some employment opportunity for some students, for some citizens in the host country as well, but this is still a small share because it's still targeted in terms of lecturers from the US market. There could be some support of health services in the host country, and I'm making reference to the support of health services where some students might actually proceed to do their clinical rotations in a teaching hospital within the host country, so that will provide some kind of health services that will lead to some kind of supporting health services in that country. Well, the cluster have experiences a number of challenges. Some of the challenges experiencing cluster include: one, inadequate faculty members, so lecturers, inadequate books, equipment, and facilities. There's a high dropout rates. There's high failure rates, especially in US MLE Step 1 examinations. The teaching method typically focus on passing tests rather than preparing students for the rigors of medicine. So there's a concerns about the quality of education that the students actually receive while pursuing such programs. Another challenge is the teaching typically occurs through internet and through distance education programs, so there's concerns about the quality of education there. Table 2 provides an outline of the performance of students at the US MLE examinations. Basically, what this table is showing is that the students at the Caribbean cluster, the Caribbean Medical Universities cluster, perform generally lower, they have lower percentage passes than their US counterparts. Take, for instance, in 2014, the first takers, only 78% of those first takers passed the US MLE exams in the Caribbean cluster, whereas in the United States universities, 95% passed. So there's a big difference in terms of performance. Table 3 shows performance at the EFFMG certification. The EFFMG is the Education Commission for Foreign Medical Students Graduates. Basically, what a student is required to do is they need to pass USME level 1, level 2, and level 3 before, and have a medical degree before they actually qualify to get certification from the Educational Commissioner for Foreign Medical Graduates from the United States. Generally, this table is showing that even within the whole international medical universities cluster, the Caribbean cluster still perform lower than their international counterparts. Another challenge with the issue of accreditation. The majority of these offshore medical universities in Caribbean cluster are not accredited. So this table number 4, provides an outline overview. A number of universities in the Caribbean, is roughly 15 of them that actually sought accreditation. Some were successful, some were not so successful, some had some degree of success in terms of getting some degree of accreditation. The United States Department of Education, through its National Committee on Foreign Medical Education and Accreditation, reviews and accreditation standards of different foreign universities. Currently, the NCFMEA recognizes only 4 Caribbean offshore medical universities as providing education that is equivalent in terms of standards to their US counterparts. These universities include St. George's, Ross, American University of Caribbean School of Medicine, and Saba University. In other words, all these other universities, so roughly in the cluster, there's roughly 72 universities in the Caribbean cluster, but only recognize the education from 4 universities as comparable to the US standards. So that means there's a significant concern in terms of the quality of education received by the other universities in cluster. The ECFMG is well aware of the quality of education offered. Subsequently, it has announced that effective 2023, which is relatively a close period of time, all physicians applying for EFFMG certification will be required to graduate from a medical university that has been appropriately accredited in order to practice medicine in the United States. In terms of recommendations, the Caribbean, the CAAMHP can be used to address the quality of medical education. In other words, what I'm saying is that basically the HP is an institution in the Caribbean that has been created since 2003 that accredits the medical universities in the Caribbean. University of West Indies is currently accredited by that agency. This is an option for these offshore medical universities in our cluster to actually pursue such accreditation. They can go to that body to seek accreditation and raise their standards to meet that accreditation standards for that body. Other recommendations, we can increase the economic contribution for the Caribbean medical universities if they employ more local staff, so both academic and administrative, if they increase the intake of local students, and if they form partnerships between the local hospitals and the universities themselves, so you can have some linkages and actually facilitate some form of research and enroll some, put out some form of their students to the local or the host countries then. That's the end of my presentation. Thank you.